understanding strokes, causes, symptoms, and life-saving tips. Hey everyone, I am Desmond. Welcome to Newton TV. Have you ever wondered what happens inside the brain during a stroke? Imagine you're in the middle of your daily routine, and suddenly your arm feels weak, your speech slurs, and you feel dizzy. That's a sign that something serious is happening in your brain. Today, we're breaking down strokes, what they are, why they happen, and how to recognize the warning signs fast. Stick around because we'll also go through a real-life scenario that might just save a life one day. A stroke, also called a cerebrovascular accident, CVA, happens when the blood supply to the brain is cut off. Without oxygen, brain cells start dying within minutes. The scary part? Once brain cells die, they don't grow back, meaning permanent damage. Think of it like this. Your brain is a city, and blood vessels are roads carrying delivery trucks filled with oxygen and nutrients. If a road is blocked or destroyed, deliveries can't reach certain areas, and those areas shut down. There are two main types of strokes. 1. Ischemic stroke, most common 87% of cases, caused by a clot blocking blood flow. Example, like a clogged pipe stopping water from flowing. 2. Hemorrhagic stroke, less common but more deadly, caused by a blood vessel bursting. Example, like a water pipe exploding and flooding an area. Mini stroke, that's a TA. There's also something called a transient ischemic attack, TIA, also known as a mini stroke. It's a temporary blockage that goes away but serves as a warning sign for a bigger stroke. Let's look at this case study. Mr. Jones. He's 65, enjoys his morning coffee, and suddenly notices his right arm feels weak. He tries to speak but slurs his words. His wife asks if he's okay, and he struggles to answer. Mr. Jones is having a stroke. This is where the FAST method comes in. There's a quick way to recognize a stroke. It's called the FAST test. Let's break it down. F. Face drooping. Ask the person to smile. Is one side drooping? Example, Mr. Jones smiles but his right side doesn't move. Arm weakness. Ask them to lift both arms. Does one drift down? Example, Mr. Jones lifts both arms but his right arm is weaker. Speech difficulty. Ask them to repeat a simple sentence. Is it slurred? Example, Mr. Jones says, I love coffee, but it sounds jumbled. Time to call 911. If you see any of these signs, don't wait. Call 911 immediately. Every second matters. The faster they get help, the better their chances. Think of the brain like a ticking clock. For every minute without oxygen, about 2 million brain cells die. Understanding strokes, causes, symptoms, and life-saving tips. Seen, a checklist of stroke risk factors. So what puts someone at risk of having a stroke? High blood pressure, more one cause. Unhealthy diet, too much salt, fat, and processed food. Smoking damages blood vessels. Diabetes affects circulation. Lack of exercise, sedentary lifestyle increases risk. The good news? Many strokes can be prevented by making healthier choices. Understanding strokes, causes, symptoms, and life-saving tips. Seen a hospital setting with doctors treating a patient. If someone has a stroke, doctors act fast. Treatment depends on the type of stroke. Ischemic stroke, clot. Given TPA, clot-busting drug, within 3 to 4.5 hours. Hemorrhagic stroke, bleed. Surgery may be needed to stop bleeding. Rehabilitation is also key. Stroke survivors may need therapy to regain movement, speech, and memory. Final thoughts and call to action. Seen a summary with a reminder to act fast. So now you know how a stroke happens, how to recognize it, and why time is critical. Remember, strokes kill brain cells fast, so you must act even faster. If you found this helpful, hit that like button, share this with someone who needs to know, and subscribe for more health breakdowns.